I will do that. There we go. We'll give it some few more minutes to get everyone to join in. How's everyone doing in this social distancing? Pretty good? There we go. Good, we got a few people joining in here. Thanks for joining in, guys. Today it's just me. Rob and Brandon are a bit busy, which is fair. We have a lot of other things going on as well. So just me today. So hopefully that's a good thing. And then tomorrow we have pain science with Brandon. So we asked a few questions to the public just to see what kind of questions they had for him about pain management and pain science. So that should be really interesting. That should be a fun topic. Yeah, so. Couple more minutes. I promise I'm preparing things for you guys. We're going to talk about the wrist. I know we talked about it last week, but we're going to get into some other injuries, and I developed a little bit of an algorithm for people to follow for the wrist, so it should be pretty good. So, yeah. How's everyone doing? Pretty good? Thumbs up if good. No thumbs up, so I guess no one's good. All right. So, a couple more minutes. Well, I can tell you how my social isolation journey or social distancing journey is. Still at the clinic every day, so I'm still coming to work every day. We're not seeing anyone from the public for non-essential services, so we don't have any patient contact at the clinic, but we still do tele-rehab, which is great. So for me, it's a bit crazy. I like working with humans, so to not have patients around is kind of a bit difficult, but it is for the best and for everyone's safety. So yeah, I'm going a bit crazy without treating patients, but at least I get to do this stuff. This is actually, I was talking to Rob about this yesterday too, and it still makes me feel like a physio. So after these videos, I get pretty excited and feel pretty good for the rest of the day. So knowing that we get to help people in a different way. So this is kind of a cool idea. So I think it's going to be good to continue that in the future. So even once things are back up and running, I think we're going to continue these videos and make sure we still help the public out. So I think once we open, or once things are open again, I think it would be good to do every week or every 2 weeks on the weekend, just to do these videos and continue benefiting the public. So everyone's here. So today's keeping up with the wrist. Tomorrow will be pain science with Rob. So hello, Olympic power and fitness. There's going to be some good stuff for your lifters in this and some good tips to follow. So the goal for today, and being a little bit different than last week, is to provide a bit of a warm-up program for the wrists, especially when you're active. So whether you're an Olympic lifter, or you're playing baseball or doing anything like that, any kind of sport, any kind of activity, even strength training, this will be important for you too. So this will benefit everyone in any context of activity. So that's the goal, is to provide these things and still be able to conduct them. So if you're, again, in any kind of sport or any kind of activity, it's important to do some sort of management. With lifters specifically, could be a little bit more specific in exercise. So we'll kind of cover everything. So if anyone has any questions at any time, just make sure you let me know. Just send a message, whether it's on Zoom or on Instagram right there. So we're gonna go over a few things with the wrist. We're still gonna go over anatomy, just because that's pretty important. So yeah, so let's get into it. So the wrist is pretty complex. So the wrist and hand has a lot of articulating joints, quite a few bones in that area, and quite a few muscles and ligaments. So wherever we have more moving parts, we tend to get more injuries. So wrist injuries can be classified into like traumatic and atraumatic. So traumatic meaning you fall on your hand and you do something a bit too aggressive. So that would be more of a traumatic injury, versus atraumatic could be a progressive injury. So for the people that notice pain that starts gradually and kind of increases with time, that would be more atraumatic, or more of a compiling injury. So those ones are usually a little bit trickier. So with those patients, they usually come in and say, hey, I've had wrist pain for several months. Not too sure how it happened. And it's a bit more tricky to treat. We still get good success with those patients, but if you come in right away, then there's more information we can learn. Because if you're just started experiencing the pain, you likely have a good snapshot of what happened. So you kind of say, hey, oh yeah, it started a few days ago. I noticed it with this activity. And then you kind of get a better picture when we take histories with patients. And good for you to know as well. So that's why I always tell people to start like a pain diary or a journal, and write down whenever you experience pain, just like write it down, like, hey, today I noticed this. And then the next day, you can kind of indicate some differences, whether it's more pain or less pain, and indicate what you do for it, right? So if you ice it or take Advil or rest or whatever it might be, then it's good to keep that log. As silly as some people think it is, it can explain a lot more. Even for me, I've started pain journals or symptom journals, whatever you want to call it, and it's helped me quite a bit with my own injuries, because sometimes you think, okay, it happened like this, but you look back and read it and say, no, that's not how it happened. Kind of like how I thought I did well in high school. I kind of lied to myself and thought I did great. And last year, I think I looked at all my grades in high school and it wasn't the case. University was better, but yeah, so you want to know, you want to have a better idea of how the pain started, so you know how to treat it. So we'll go over some anatomy. I'll have to do the screen sharing here. Good. So we have multiple joints in the wrist. We're not going to go through all of the joints just because it can be pretty tricky. And if there's specific questions, we can get into that. So I'm going to rotate the camera the other way. So you have the wrist here. You have, I'm going to just get rid of the glare here. So you have multiple joints in this area. So you can see this is the wrist, right? So this is kind of looking in this region of the hand and the wrist. So you have multiple joints. You have all these small bones here called carpals. They articulate as well, along with the radius and ulna. So that's the forearm connecting to the wrist. So the radio-ulnar joint here, which is highlighted in yellow. And then you also have the distal radio-ulnar joint, so where the ulna and the radius meet. So you have quite a few articulations in the wrist and hand to make our wrist and hand move like it does. So it has quite a few movements that are available. If we look up here, the radio-ulnar joint, so you have the proximal radio-ulnar joint, so kind of up by your elbow, and also your distal radio-ulnar joint. So two joints that articulate. So that kind of gives you that twisting motion of the arm, versus the wrist itself has these motions, right? So you have a lot of articulations, so a lot of things that can get injured. This does show a lot of the ligaments around the area too. We don't need to get into the specific ones because there's quite a few to go through. And if we go back to this image, we also have people that hear about the TFCC, or the triangular fiber cartilage complex. Pretty tricky to say, but that is on the outside of the wrist, and it's a complex that provides support to the ulnocarpal joint and that lateral aspect of that wrist joint. So it is a common injury in sports or activity. So if you fall on your hand, commonly injured area is this. Like if you're a batter and swinging a bat a lot, or any kind of rapid force that you're doing, boxers, they get this kind of stuff. Quite common, like it happens quite a bit. So important to know the area a bit. So it's made up of cartilage, ligaments. It's a whole complex. So it is pretty intricate in how it works. Those injuries can lead to splinting or casting, and even surgery if they're pretty serious. So good to know a serious injury from a not so serious injury. So the main thing we're trying to demonstrate here is the wrist is a very complex area with quite a few joints. So if something's not working well, it's going to tell you right away, whether it's a stiff joint or you have a ligamentous issue or a muscle issue. It usually presents pretty quickly. So there's no images of the muscles, but you have a lot of muscles that run into the wrist and the hand, right? So a lot of intricate muscles to give the wrist and hand its movement and its strength and its stability. So yeah, that's that. I will flip the screen over here. Stop share. So yeah, that's a quick, very fast anatomy lesson. Wrist is very complex. We see quite a few injuries, can be traumatic or atraumatic. So it can happen from like falling on your hand, or from sports that require rapid motion. So if you're a batter in baseball, if you're throwing, Olympic lifting would be quite a bit of wrist movement. So if you're doing like cleans or snatches, requires quite a bit of wrist mobility and strength. So having it stable and mobile. So, and often tricky because sometimes people have a lot of mobility, so a lot of movement, very flexible, but they're not very strong. So you lose that stability. So you want to balance both out. So for me, when I was starting certain sports like kickboxing and stuff like that, wrists were pretty stiff. It took some time, but they loosened up a bit. So when I started Olympic lifting, that's when I had a lot of issues. So when I was doing cleans, and I did mention this last week, when I was catching cleans, I didn't have much of wrist extension. So the weight would push down on my wrist to force it in that motion. So I started getting numbness and things like that in my hand, and quite a bit of forearm and wrist pain. And I actively treated it. So mainly just doing wrist mobility exercises, and I was fine. It took a couple of weeks, but I was good to go. Now there's other issues in other parts of the body, but I guess that happens when you get a little bit older. So what I thought I would do is I made an algorithm, or like a flow chart for wrist injuries. And I think as a physio professionally, I like to keep things simple. So it helps patients with simplicity, so they understand what's going on. So there's nothing like explaining, using triangular fiber cartilage complex as a word to a patient is not going to mean much. But if you show them what it is in a simple way, then it's quite easy to understand. So that's the biggest thing I get my patients to do, is to understand their injury. If you can understand the injury, then you're going to be more likely to buy into the treatment and to do the activities that we recommend. And then it's your body, so you should know what is wrong with it. So if you have an injury, you should know exactly what it is, and to do research. So I always tell people, hey, look at resources online, and Google and things like that. That's okay. You just have to take it with a grain of salt and make sure you find good resources. I know Physiopedia is a resource that's pretty good. it is reviewed by physios and changed and edited by physio. So I think that's a good start. So if you have an injury, you just type in the injury and Physiopedia, and it can give you some videos and give you some tips right away to start. So I have, and this could be kind of used for anything, but I have a wrist injury algorithm. Hopefully everyone can see that. Or actually, you know what? I'll make this a bit easier. Let's flip it around the corner. So you have wrist injury. So that's the slide that I made. So you have a wrist injury. I put 2 columns. So you have going into serious and not so serious. So you have a serious injury. Let's say you fell on your hand. You heard a snap, felt a tear. You know something's not right. You're moving your wrist. It's clunking around. It's excruciating. That's when you likely have a serious injury. There could be immediate swelling. Could be lots of bruising. So extreme pain would be one thing. Things don't look right. So you could actually have a fracture, and you could notice that pretty quickly. It's very painful to touch. It's very hot and bothered, and you can't function. So that's a big thing right here is you can't function very well. Meaning that you can't go to work, you can't do your activity. It's stopping you from doing things. So that's the point you go get help with an exclamation point. So whether that's to your rehab specialist or a physician or anyone, a hospital, you need to get some help at that time, right? So that's where you likely get imaging, see a specialist and that kind of stuff. And if it's something that's surgical, you'll be told that pretty quickly. And then you follow the protocols, right? So if you're given a cast by the specialist and say, hey, wear it for 6 weeks, you should follow those protocols and wear it for 6 weeks. And do what's recommended, because that's when you need to keep the body safe. You don't want any issues there. The next part would be to get rehab. I put it at the end, but you can insert rehab into any one of these areas. So I just said when appropriate at the bottom here. So rehab you can get right away to look at things, to screen things, to rule things out. Go get help. Sometimes they say, hey, wear a cast, but still see a physio for some management and maintenance and things like that. Usually when you're out of the cast or a certain time has elapsed after surgery, then you're going to be told to get some physio or rehab. So rehab can be put at any point. So then you have wrist injury, not so serious. So you can still function. You have quite a bit of pain. You can still have bruising and swelling. And you can do tasks, but with some difficulty, meaning you can go to work, you can work out, you can do all of those things, but it is difficult to do. So when I had my wrist injury, things sucked for a bit, but I was able to continue on. I was able to still, dress, cook, go to work, things like that. It was very uncomfortable, but I was able to do it. So that's when you know it's not so serious. And that's when you can still see a physio, right? So next step, rehab or research, see a PT, see a physiotherapist, see anyone that you rely on for rehab. And research too, so feel free to look online. Again, with a grain of salt, don't believe everything you see. And that's when you get a management plan, right? So when you see a physio, you should be told what to do, what not to do. If you don't see a physio or you don't see a specialist in rehab, the next step, and this will be worked on with the physio in either case, is manage your pain. This is a big one. You need pain management. So if you fall on your hand, you're a boxer and you throw a punch the wrong way, you need to manage the pain. So whether that's ice, non-steroidal anti-inflammatory drugs, and rest meaning rest from the activity that caused the issue. So if you're an athlete and Olympic weightlifting caused some wrist pain, then adjust what you're doing for lifting, whether it's discontinuing for a week if it's more serious, or just going lighter volume. So that's what I mean by manage pain. In the acute phase, so the first week, it's very important to manage that pain. And a lot of things that you do in physio will be pain management and education about the acute phase, so that fresh injury phase. If it's a chronic issue and it's been several weeks, then you kind of get into other things right away. And then you have mobility and stability. So you have programs to focus on both. So Are you stiff? Is the wrist moving fully? No. Okay, so you need some mobility exercise, mobility management. Is it stable? So let's say if you are mobile, you have good range of motion, then you need to stabilize or strengthen the area. So, and then you manage with both, right? So you'll still likely do both of those things in all exercise programs or sorry, physiotherapy rehab programs. So that's kind of a nice, I think a nice algorithm that helps break it down. So if people want a picture of this or want it typed out, I can send it to them. And it can be applied to many different areas of the body. As simple as it is, it's good to keep it simple and kind of know what to do, when to do it. That way, if it's not so serious, you don't need to go to the ER, for instance, and say, hey, my wrist pain is like a 3 out of 10. Can you take a look at it? Still, like, someone's still going to look at it. It's still important to see it, but you might be managed better in a physio setting or some other professional. So that's that. Good. So back to me. Any questions so far about any of that? How was that flow chart or that algorithm? Was it okay? And I'll show it up to here for everyone there. So that's that. Just showing it to the Zoom. Good. Brooke says thumbs up or a thumb up. Anything in terms of questions, specific questions or anything like that? I like those algorithms a lot because I look at a lot of research, and oftentimes, even as a physio, it's best to keep it simple. We often try to figure out exactly what tissue is at fault, but if you know, as a physio, if you know it's, you know, a muscle or a ligament or a bone or a joint, then if you figure out what structure is at fault in terms of if it's a muscle or a ligament, etc., then you can develop a treatment plan because it's going to be the same for anyone regardless. If you screen out everything serious, then it's not, you need the pain-free range of motion first with any injury, and then you start doing the strength and stability exercises. So if you do the strength stuff while it's very, very painful and there's no mobility, then you're going to run into some issues. Then you know it's too aggressive and you need to change things. So that's the way I think of injuries, and it leads to good results. And that way you don't do too much. So if the program's easy and someone's like, well, hey, I did all the exercises and it was a piece of cake, wasn't challenging, didn't cause any soreness, then maybe, okay, let's bump it up to some strength training or something like that. So yeah, that's that. That's all I want to say about that. So we have sprains and strains in the wrist. So sprains referring to ligament, strain referring to muscle, and you can often get both involved in the wrist area. So still good to distinguish the difference between two. So strain, muscle, sprain, ligament. So if you have a muscle strain, you could have mobility issues, a lot of weakness, things like that. If you sprain a ligament in the wrist, it's not going to be very stable likely. So if you're not very stable, then you need to strengthen that area and keep it safe. We do have a question here. Can you discuss proper overhead wrist position for jerks and snatches? Okay, we will get into that. I will get into that as we do the exercises, so I will remember to do that. It's a good question, specific to Olympic weightlifting, but still pretty good to know a little bit about. Good. So, so for exercise, and we'll get into that jerk and snatch position. So exercise-wise, we went over this last week a bit, so I'll brush up on it. With stretching, again, it's not meant to be boring. You got to do it. So doing these wrist extension stretches, right, to stretch the flexors of the forearm, and into the flexion to stretch the extensors of the forearm. So these ones we're stretching here. Normal area to get the stretch would be kind of up in that forearm area. So I kind of get it more up into here. So closer to the origin of the muscles, and I hold it, and there's a little bit of a burn, Hold it for 30 seconds, relax. Hold this one for 30 seconds, relax. Do the other side, 30, 30, 3 times on each side. You could also do what's the prayer stretch to stretch your flexors. That way you can get both done at the same time. Reverse prayer. Hold it for 30 seconds, 3 times. So any stretch, 30 seconds to a minute, and doing 3 repetitions of it would be very important to do. I had a specific question about the Tyler twist exercise with a TheraBar. You can also, well, we'll try to figure out some ways to do it at home too without one of these. These you can order on Amazon. It's just a twist bar, so it has some resistance. It's kind of like a rubber. Different colors represent different stiffness. So yellow is the easiest one. That's why I grabbed it. And then you got red, green, blue, black. So the Tyler twist exercise is for lateral epicondylitis or tennis elbow. So having pain in this area here, that would be tennis elbow. So that's the lateral epicondyle. That's the extensors of the forearm. So this motion right here, if you're doing that quite a bit, they say tennis because of backhand and things like that happens in various sports. Even desk work, I find a lot of people that are typing a lot are using their extensors quite a bit and develop this issue over time. This is one that's more of a progressive type of injury. So it starts off pretty mild and then it can get worse from there. So that's when it requires some activity modification. So getting an ergonomic assessment or just seeing how you work at a desk, or if it's sport or activity, figuring out what specific motion is causing it and kind of go from there. So the Tyler twist is, so my arm is kind of by my side. My wrist is an extension, so it's twisted like that. So the first thing I should mention is that the affected arm is on the one at the bottom. So you come into extension, grab it on top with the other hand. So this hand twists down like that. So palms facing out. You grab it, twist, come back to horizontal, and then you slowly untwist the bar. So this is called an eccentric exercise. Eccentric being controlling the muscle lengthening. So that's where you get a lot of those strength things. So if you're doing this, if you're coming from here to here, you're controlling that muscle into neutral. So that's very difficult. And so this is an eccentric exercise for tennis elbow or lateral epicondylitis. A very good thing to do. So you go into, and even with the lifters, with any sport, very good to do. So your wrist is an extension by your side, grab top hand, twist, go into horizontal and slowly go back into neutral. So I'm controlling my wrist coming down. So I feel a pretty good burn up in here in the forearm. Good, hopefully that answers that. And even with wrist exercises, you could twist up and down like this. So you don't have to do it that way. You could kind of come in, twist back and forth. What you could do at home, if you don't have one of these flex bars or TheraBars, you can grab a bunch of towels, roll them up, and just kind of do that. So let me grab one right now. I can grab a towel. It doesn't work as good as the bar, but it could work well. So you want to grab some towel, and you can do that too, right? So if you kind of bundle it up a little bit, you can twist it and do those kind of exercises as well. The Tyler twist doesn't work as well with the towel because there's no resistance, like there's no spring in it. So it's not rubber, it's not gonna want to return to neutral. So you can still do the wrist extension, flexion exercises like that with the towel. So there's some stretching, there's some easy ways to do some exercises. TheraBars, again, you can get on Amazon. I think they're like 10 or 12 bucks. Another good thing to do for any activity would be to roll out the forearm, right? So grab a ball and roll out the actual forearm itself. So pushing into areas, trigger points being tight areas of muscle, pushing in, holding, releasing, go on to the next area, holding, releasing, next area, and so forth. So you can get into quite a few of the tight areas of the muscle. Works for any area. So if you're using a foam roller for your quad, for example, same concept. So going into a point that is causing a bit of grief, finding that trigger point, letting it release, it relaxes, go on to the next spot, and so forth. So good things to do as maintenance. So this you can do before sport and activity, after you could do it at home when you're just hanging out on the couch. Same with the stretches. Definitely stretch before activity, so you warm up nicely, right? So a lot of it is to mobilize the area before you're going to do heavy strength training. That's why stretching is so important, and that's why it's like a warm-up programs involved in many sports, and you see it all the time, right? So those are good things to do. Trigger point release, stretching. Another couple things you could do. So for the lifters, what I've seen quite a bit is grabbing a stick. Doesn't have to be this big, and then coming back and forth like this as a good warm-up. This provides some resistance for your wrist, so it's a good stability strengthening exercise. You could even hold it in mid-range, so not all the way down, not all the way up, and hold it and keep it there until you burn out, so until you fatigue. And then the other side until you fatigue. You can even twist it in and out, right? So if you have a hammer at home, it works perfectly. So twisting a bar in and out like this, doing that until you fatigue, until you get tired and you can't do it anymore. That's the pronation, supination motions of the wrist and forearm, versus the other ones more so radial. You're strengthening the radial deviator, so coming this way. So a lot of different motions in the wrist and the forearm. So twisting out and in, this could be a regular part of your program. If you have wrist issues, or if you have some, there's something lacking. So twisting back and forth. So I'm kind of getting sore now. So I'll switch sides and do it on the other side. Hammer is good because you have the weight furthest away from, so it's a longer lever arm, so it provides a little bit more resistance, so not a bad thing to do. So if it's a hammer, let's pretend this is a hammer. I don't have one here because everything's brand new, so I don't need to fix anything. I should just bring it from home, but so coming back and forth like that, that's a good exercise as well. If you're looking at more equipment, you could also use a kettlebell. So I like kettlebells a lot. Lots of different ways to do exercises for the wrist with the kettlebell. I'm just picking one just to make it a bit more simple and work into a program easily. So I don't want to give like 40 exercises and get people to be like, well, what do I do? So let's focus on these stretches, 30 seconds, rolling out the forearm, doing some twist bar exercises, and kind of doing some rotation motions. Next one you could do is kind of like an overhead press with a kettlebell. So this is going to be a stability exercise. So you have a kettlebell, this is about 10 pounds, and you hold it up like this, so the bell coming up, and so doing an overhead press just like this, coming up and down, just like that. If you have two, you can do it on both sides. So what's happening here, I like this exercise because you're focusing on many things at once. You're focusing on shoulder stability and strength, and also wrist and forearm stability and strength. So you hit a lot of different things all at once. So very simple, very effective. So coming up like this, coming up and down. So when you look at this exercise, obviously I'm moving the shoulder up and down, but what you see is the wrist is also staying neutral. So to do that with the bell up, it's a pretty unstable exercise, meaning it's challenging your stability. So right now, after just doing 5, I can feel some things fatigue in my wrist. So I'm going to switch hands. So doing sets of 7 to 10 and 7 to 10 reps for 3 sets, coming up and down like this, up and down. So this is probably an okay weight for me. I could probably go up to 15, coming up and down, keeping the bell up. So for all the overhead sports, Olympic lifters, it's great because pressing is a very common exercise in programs, and it's involved in all the lifts, right? So if you're doing a snatch, that's going to benefit you. If you're doing a jerk or clean and jerk, that's going to benefit you. So the bell up and doing an overhead press, just like that. And keeping the wrist in neutral. So when I'm holding the bell, my wrist isn't down like this, and it's not back like this, it's straight. Just like that. And keeping it like that. Very good exercise. I got a burn now. So, and then the other one you could do, which we did touch base on it last week, and you can grab 2 dumbbells, is doing wrist extension, radial deviation, and then flexion. So all 3 motions for 7 to 10 reps and 3 sets. So if you're at the gym, grab 2 barbells. If you're at home, if you don't have a barbell, you could use like a milk jug. Even for the overhead press with the bell, you could grab a milk jug and do it and just put in enough water to give you enough weight. Pretty straightforward. And then doing your, let's say I'm sitting on a bench, doing wrist extension, like that, radial deviation and flexion. So all 3, 7 to 10 reps, 3 sets on each side, and then do the other side, just like that. You want your forearm to be supported. I have my leg crossed just for demonstration purposes, but you could do it on the edge of a bench, coming up and down. You can use a barbell if you wanted. That way you're getting both done at the same time. So that's the exercises I wanted to show for the wrist. Pretty straightforward, nothing too crazy. I really like that overhead press. Even if the kettlebell ones where you're holding the kettlebell and walking until burnout, that's going to be the same thing. That's still going to give you that wrist stability, right? So the one coming up all the way and walking, usually I get people to put the bell on the side if it's a shoulder exercise, but if I'm trying to work on the wrist, then I have the bell up and you're walking just like this, right? So easy ways to challenge the wrist, and those aren't, I don't want to say as boring exercises, but you want exercises to be enjoyable because then you're more likely to do them. So that goes through a good wrist warm up, right? So we got the extension, flexion, stretch, rolling it out. We have grabbing a stick, going back and forth, grabbing a stick and doing this, and then the overhead press, and then the wrist extension and flexion. So for the strength stuff, so anything with weight, you could do a couple times, like 2 to 3 times a week. For the lifters and athletes and things like that, you could do those as a warm-up. So we talk about warm-ups for a bunch of different areas, and next week we'll go into like hip and knee and things like that. And the thing is, it's not to do the warm-up for every joint, because that would take an hour or 2 just before training. So what you want to do is to focus on the area that you notice some challenges in. So if you're finding issues in the shoulder region or the wrist region, then do this stuff as a warm-up, right? So I have a shoulder, a right shoulder and a right hip that bothers me with activity at times. So I do a general warm-up for everything, so bike or treadmill or something like that. And then I get into doing my mobility and stability exercises for the shoulder and for the hip. Wrist-wise, I do a few things if it causes me issues. So it's kind of like figure out what's giving you some limitations and then just target those things. That way you're kind of your own rehab specialist or physio, right? So yeah, that's the easiest way to go about the wrist. And then we got that question for Olympic lifters. I'm just going to go back so I read it correctly. Discuss proper overhead wrist position for jerks and snatches. Okay, so let me grab a stick, a longer stick. This should do. So snatch being kind of overhead like this or catching it in this position. What I typically recommend for lifters, and I don't want to step on any toes and things like that. For me as a physio, like I look at lifting from a rehab perspective. So I don't want people to, like I'm not a certified coach, but for rehab wise, like I like to keep the wrist in neutral. So if you're snatching, your wrists aren't brought forward and they're not too far back, right? So some people, when they lift, let me lift this up a bit. I should probably stand up. So I'm just gonna raise the camera up a bit. So if I'm doing a snatch, throw it up and catch it, you don't want the wrist corked back too far or too far forward, right? You go too far forward, you're likely just gonna drop the bar forward. Too far back, you're likely going to drop the bar back or fall backwards. Keep it in neutral, so not twisted out, not twisted down, but keeping it straight, right? So, and similar is true with the jerk, right? So you jerk, same thing. I should probably lower my stool here. So if you're doing a jerk, I'm just going to crouch down. If you're doing a jerk, same thing. You want the wrist straight up, not corked back, not corked forward. Because if you go too far back, so if you're catching the weight and it's too far back like this, then you can injure your flexors of the forearm. Too far forward, you can strain the extensions of your forearm and cause injury that way. So I say if you find your athletes lifting, look at their wrist position, which you likely already do as you're assessing their whole form. So if they're catching a snatch, for instance, and their wrist is too extended, then work on the flexors, right? So then work on doing these kind of motions with a barbell. If it's too far back, or sorry, too far forward, so flexed, then going into the extensors and doing these kind of exercises. And if they're too wobbly and all over the place, then it's really good to do those overhead presses with a kettlebell or overhead carries with a kettlebell. That way you're still focusing on the shoulder stability as well. And then that's kind of what I would recommend. It's always neutral for the wrist, or trying to stay neutral. Yes, when you do your heavy lifts, like you're going for your PRs, your personal records, or in competition, there's going to be deviation from that. So we all know when you're doing something at a very heavy weight, the form can deviate a bit. Like you're still doing it well, but you're putting all your effort into it. So therefore you might have some issues in that. But when it's light, I'd say see with your athletes, see if they're too flexed, then the bar will likely come forward and it'll fall, or too far back, bar goes backwards, and see what's happening with that. So if they're dropping it a lot or not catching their snatches, figure out which way the bar is going and then go from there, see what the wrist is doing after that. A lot of the times it could be a shoulder issue too. Yeah, that's the best way to answer that. I think that does go through. Does that answer the question, Olympic Power? While we wait for a response, any other questions about the wrist or forearm or anything at all? Nobody on Zoom? Okay, no questions there. Any questions, just make sure you let me know now. Would be a good time. Or to direct message us, email us, whatever you like. So Sunny or info@pursuitofmotion.com, or just message us. So for boxing, can you prevent wrist injury? There's a certain way to wrap your hands and wrist before hitting the bat. Yes, good question. I used to do some boxing, kickboxing, and things like that. I don't want to comment too much on specific ways to tape the hand. Like hand wraps are a bit tricky. I wouldn't be the best about that. Your coach would know a little bit more about that. But as long as you're anchoring the wrist, so as long as you're wrapping the hands, you're anchoring the wrist as well in between and after when you're wrapping. So if you wanted to and you find there's a lot of issues when you're boxing and your wrist hurt, just try to get some kinesio tape and just wrap it right around the wrist before you tape up your hand and wrist. So get some kinesio tape and come right around a couple of times. So get 2 strips, go around once, tape it, go around another time with the other piece and tape it and lock it in that way. If you're hitting the bag, I'd be curious to see what you're doing when you're fatigued. So same thing with the Olympic lifting is you want your hand and wrist in neutral, right? So you're not going to punch like this. I mean, it's not going to be that far deviated, but you don't want it to be like that or too far back. So I would see with some kinesio tape, or just doing a couple more wraps around the wrist to stabilize it and to maybe slow it down and see how you're punching. See what kind of punches, whether it's initially that hurts or later. If you get tired, you usually change how you're boxing or you're lifting. So usually when you're tired and after quite a few reps and sets, that's usually when injury happens. Or fresh out of the gate, you don't warm up, that's when you get injured as well. Or that's when I see it a lot. Does that answer the question for boxing? And yes, you can prevent injury. So I'm not saying tape's going to prevent it, but it can stabilize it a little bit. But prevention would be to do everything that I just talked about. So doing a lot of that wrist mobility exercise, so stretching it back and forth, doing the rolling and that kettlebell stuff, like really good thing to do, whether it's at home with a kettlebell, if you're lucky enough to have one, or a milk jug, but really just challenging that wrist, right? Like hold it up, do some presses, let it burn out. It's okay to burn out if it's not significantly injured. If it's causing pain just to hold it up like this, then that's when you break it down and just do some maybe extension exercises with a light weight, and kind of go from there. So this isn't going to be for serious injury, obviously, or like a more serious strain or sprain or strain. It's going to be for people who are active and notice a few issues here and there. So yeah, I think that's a good way to sum that up. And again, if these don't actually answer the questions, just don't be shy and let me know. Great session. Okay, that's good. Thank you, Kristen. And Olympic Power, if you do have questions more specifically, you can always email me, and you can just send me a chat thread on Instagram. But that's the thing, is just a lot of things I do is I break things down. So if I'm looking at a runner, someone walking or doing their sports, so lifting, I'll kind of do a bottom up or a top down approach. So I'll look starting from, let's say from the bottom, I would look at, okay, their ankles, how are they landing, how are their feet positioned, their knees, their hips, their back, and then kind of go up from there, or go top down. So if I notice some wrist issues, I'll look at, okay, which hand is it, which side is it? So if they're twisting, so if they're doing a snatch and they're twisting a bit, is that going to be the wrist? Is that going to be the elbow? Is that going to be the shoulder? What is it going to be? So yeah, biggest thing is when doing the lifts, whether it's a snatch or the clean and jerk, coming back and seeing if the wrist is extended or flexed as they catch it. So both can develop issues, but if you grab it or catch it in the right position, in neutral, so wrist being straight, you're going to prevent a lot of issues. I think the wrist might be underlooked in certain sports and how important it is. So figure out, is it a stability issue or is it a strength issue? Sorry, strength stability or like a mobility issue. And that way you can kind of determine where to go. So that algorithm that I showed, break it up into serious, non-serious, and then kind of go from there. That way you're not dealing with it in an inappropriate way. No problem. Olympic Power, no problem at all. And then continue firing questions. And sorry, Vince, happy belated birthday. You just joined in, too late. You don't get any of this. Yeah, so kind of go over, maybe I'll do just a brief description of that algorithm again. And if you want a picture of it, hopefully without spelling errors, I can send it to you, right? So any sport, any activity, wrist injury, is it serious? Is it not so serious? Go get help. If it's serious, right away, follow the protocols you're advised and get rehab. So, and the rehab can fall into any point. So even if you get help and it's a very serious issue, likely the specialist or physician is going to say, hey, do some rehab, start right away, do some passive exercise, or not passive exercise, some stretching and things like that. And then go from there. So you'll be given a clear protocol. If it's a fracture and then it's surgical, you'll say 0 to 6 weeks do these things, 6 to 8 do these, and from there, kind of just follow the protocol. So then you have not so serious injury, you're still functioning, still able to do everything. Get some rehab, see a physio, do some research. Is it very painful? Likely is. So manage the pain, use ice, take some Advil if you can, take Advil, rest, tape it up. Rest being, don't be physically inactive, just take it easy from that activity or sport that caused the injury. And then you kind of go into, is it a mobility issue? Is it a stability or strength issue? And kind of treat it from there. So nice little way to think about any injury. I'll probably make a lot of those for the next injuries coming up. So I think that's a good way to break things down, make it easy from a physio perspective and from a client or patient perspective. So neutral wrist positioning in all activity. So whether you're doing some rows or banded external internal rotations, whatever it is, presses, make sure the wrist is always in neutral, often overlooked. We want to standardize all exercises. We want to do them the same each time. And if you keep the body in neutral, it's very important. That way you do things the same way each time. One of my mentors, who's actually watching, Vince, hammered that down for me. So even treating somebody on a bed, you want them to be in a neutral position each time you treat them. And that way you're delivering the intervention the same way each time and keeping things consistent. Yeah, that's all I got to say. Any questions? We got a few minutes left. Today I didn't think I'd be speaking for that long, but I did. Same thing Rob told me yesterday about his vestibular rehab talk. He thought he was going to be like 30 minutes, but it turned out to be a full hour. So tomorrow is going to be pain science with our pain science specialist, Brandon. He's had a lot of post graduate work on it. He's currently doing his PhD as well in that field. So he's the expert for that. So if individuals with chronic pain or chronic pain issues, I know we don't like using that term as much. So pain management is what he's going to focus on, and kind of how to go about doing that and treating that yourself. He's very good at what he does. He also runs a Gladbach group-based rehab program, so important to check that out. And we have more details on that in social media and things like that. So, and give us feedback. Let us know if the way we're presenting things is a way that you like receiving it. If there's different ways we can do things, let us know. We do want to balance some theory with exercise. So we still want to go over some anatomy to make sense of the injuries and why they occur or how they occur. And we still want to do activity and keep people active and try to be able to do this at home, right? So that's why the milk jug versus kettlebell. Most people have milk jugs or something like that. And just make it easy for you guys to take care of yourselves during this whole unprecedented time. So if there's any questions, you can ask in the next minute. If not, we'll just sit here in silence and look at each other. Yeah, we won't actually sit in silence because I can't stop talking usually. So yeah, and then maybe we'll do, I was thinking of trying to get some guest speakers in as well, in their respective specialties. Hopefully Vince can, if he's still watching, and even go through treatment philosophies one day and talk about what makes us physios, why we like doing what we do and how we do it, how we carry it out. So oftentimes there's always a goal and there's multiple paths to get to that goal. So I might treat a certain way, someone else might treat a certain way, and it will just be, we'll both be just as effective as one another. So it'd be cool to see other physios and their perspectives and how things work. Oh wait, we got Vince saying, phew, good thing I joined in at the end. It will be recorded, Vince. It actually is being recorded. There will be a link to it, but I'm sure you know risk pretty well, as you know. You have a very high level of experience. Thanks for all the great info. Looking forward to tomorrow's talk. Great, yeah. Chronic pains or pain management, pain science is a very important thing to go through, and I'll learn something too, just like I learned stuff off Rob yesterday for vestibular rehab. So yeah, I'm excited for that. Other than that, guys, let us know, drop us a line, shoot us an email, and keep in touch with us. We like doing this. We really like doing this. And I think it's turning into something great. And we'll continue doing it in the future as well. After, when we're allowed to walk in public freely. Without taking too much of your time, I'll let you guys go and let us know, give us some feedback. Peace out. Thanks, Vince. Love you.